Reach in, please. Hello. Hello.
Hello. Sir, it's audible.
That is.
Ask everybody to come inside. Case has been started. Inform them.
ఏ ఓంకార్కి ఫోన్ చేయి, ఎవరు లేరు ఇక్కడ. అమ్మమ్మ, దిస్ మ్యాన్ కెనాట్ మేనేజ్. ఆయనకి తెలియదు, ఆయనకి ఐడియా లేదు. ఆయన కెన్ యూ పుల్ దిస్ డౌన్? చెవులు తప్పించండి చాలు. ఈ చెవు కూడా. Connect our system. Wait. Where is that tube? Our tube, silicon tube. Not that tube, silicon tube. Pipe. Suction tubing. I gave you one tube, right? 5 mm tube. Hello, am I audible?
Yes, sir. You're
Yeah, you. We are waiting for some equipment. Meanwhile, you can ask me some questions if you have.
Okay, sir.
Now I am using my conventional system. ఒక్క నిమిషం. And now the one what I am using is what I've been using it for the last 22 years. This is the irrigation system.
Yes, sir. Take this.
150. Yeah, fine. Okay, are you people with me?
Yes, sir. Yes, sir.
Yeah, hold it. Now, if you can see that this is this Emma. This is what I was trying to tell you. Like initially I told you. Okay. Now, can you see that? Now this is called a prospective hysteroscopy. I have already told madam that it is an endometrial hypoplasia. Okay.
Okay, sir.
Now look at this. Now, am I audible?
Yes, sir.
See, now I told you it is a teardrop. I told you, no, if you remember my lecture. Now see that it is horizontal. So you rotate your scope horizontally, and then you will get into the cavity. As simple as, okay.
Okay, sir.
And this is her previous C-section scar. Okay. This is where, one second, don't pull, just twist. Okay. Now, when once you get into the cavity, look at, I'll show you. Don't worry. You ask me whatever that you want, I'll show you. This is the right tubal ostium. If you can see that, can you see that?
Yes, sir.
Go close, and there's I'm positive that this lady would have endometriosis. See, these are endometriotic spots. If you can see that, can you see this? So it's not like looking at the ostium and coming back and see, these are all endometriotic spots. I'm positive that this lady must be having dysmenorrhea. I don't know if I'm right. And this is what is called a most. This is progressive secondary dysmenorrhea. I want the postgraduate to answer what is progressive secondary dysmenorrhea. Understand? Now this lady also has a small septum, if you can see that. Okay. Now that is the posterior wall, if you can see that. And now if I magnify this, okay, look at that. Now this is, you can study the gland openings or columnar Can you see those small openings?
Yes, sir.
So it is not only looking at the cavity, looking at the ostia, it is also you have to study the endometrium. Okay. Can you see that?
Okay,
So
sir.
this is what is called panoramic. Now, yeah, look at this, Dr. Vandana. Now, if I am seeing on this side, I am able to see the right ostium, but I am not able to see that. See, there's a curve, right? That is called a lateral spur. If I go into that, see now, can you see that? I have to go advance my scope, then only I'll be able to see that. So this is what I am going to cut. Surgery చేసేటప్పుడు అవి చేయకూడదు అశోక్. Okay. Now look at that. These are all the endometriotic spots, if you can see that. Can you see this? The golden brown or burned matchstick or whatever you name. Now, the problem with the magnification is it loses its resolution to certain extent. Now I am back to the one, and this is the C-section scar. Look at this. There's a small polyp over there. Look at that. Can you see this? Look at this. This is the C-section scar. Look at that white thing. Can you see? Are you able to see that?
Sir.
So what has happened? I think they have sutured the posterior wall to the anterior wall. That is why you have got this curvature. You understand? So, and that is, look at that. Are you able to see the scar?
Yes, sir.
Yeah. Yeah. This is the section scar. Can you see that whitish part? And that is the posterior aspect. And look at that. Look at that. You will also see the RBCs going. You would have seen that, just the blood has flown through that vessel. I don't know how many of you have noticed. And this is the endometrium. This is the endocervical folds, arbor ovice. Okay. And this is, you just have to take off chair. Now I have used my endomat in this case. I have an different endomat. నాది వాడండి మీరు లేకపోతే ఏది అయిపోయింది. And now you can do the endometrial curettage. I am positive that, and I am also interested in knowing that this would come as endometrial hypoplasia. If you see that the endometrium is hypoplastic, edematous, and thick. Edematous and thick. Okay. And whose dilators are these? Nice dilators. I brought these dilators. I think I want to cure it. మీరు ఎందుకు పద్దాకి గిన్నె తెచ్చుకుంటున్నారు? మనకి ఏమైనా స్వీట్స్ పెడితే తీసుకురండి గిన్నె. ఓకే. షార్ప్గా లేదమ్మా క్యూరెట్. షార్ప్గా లేదు. షార్ప్ క్యూరెట్. Stand up. When we are not doing, you stand up. Then your back will not go for a 6. You will be able to assist for more cases. I have a curate which is 50-year-old. And I bought so many things. This is nice. This is good. Look at this. The curate should be like this. Come. Now you will get the tissue. Okay. వచ్చినట్లేదు. Grating sensation. Can anyone feel, listen that grating sensation?
No, sir.
My assistant could hear. She said grating sensation is on. There are some small bits. I don't know whether it is enough or not. I think the Dynogest would help in this case. It's an endometriosis, and you have to go for progressive betadine. Speculum camera. Any questions on this? Speculum. Yeah, doctor, you can pull the patient. Pull. I'm pushing. You pull the draw sheet. Lagan, lagan. Draw sheet lagan. Okay. Right. Hey, na equipment off my mic.